All right, now we turn the spotlight to the critical link between energy and healthcare delivery in Nigeria. Many hospitals and primary health centers across the country still struggle with unreliable electricity, affecting everything from, surgeries, vaccine storage, and diagnostic equipment to basic patient care. And it's quite sad. You hear of cases where we lose a life in a hospital because they didn't have power to power some of their equipment or even store some of these critical, medicines, that we need to take care of our health. Well, to help us unpack this, we have Dr. Agwor Ibuta, the Vice President, Medical Initiative for Africa, Abuja. Great to have you on the show, sir. Good morning.
Thank you for having me. Good morning, Nigerians.
Good morning. So, why is reliable power supply is such a pressing issue for the health sector in Nigeria? Some would think it's a no-brainer that a health facility, in 2025 should be somehow shielded from, energy issues, knowing how critical, healthcare is.
Well, imagine that I will share a story which plays out in many health facilities across the country, across the sub-region. Imagine you walk into a consulting room and the consultation is going on the electronic medical record, and the light goes off. That would completely abort that process. Or you go to the lab and you want to do as simple as a malaria test, and you don't have a microscope and you don't have light to power that microscope to see the parasite and deliver a diagnosis. Or you cannot even do the chest x-ray because you don't have light. Or maybe you are on the surgery table, you are in theater, and you are in a ventilator that is powered by light and it goes off. That is catastrophic. Or you go to the immunization center and you are giving vaccines, and these vaccines have lost their potency because there has been a break in the cold chain, because there has been light interruptions, as the case may be. Or you go all the way to the pharmacy, and the drugs that are supposed to be stored in certain temperatures have lost their potency because of heat and all of that. So this is a story that plays out in many of the systems we have in place. And so there is an initiative that would hope to address that. In fact, it's called the Power for Health Initiative, which has been put together by multiple partners, led by the Federal Ministry of Health and Social Welfare. I mean, the information we have concerning that summit is that it's the first of its kind. We've not had that kind of thing. You have people who are in the government sector and the private sector and the development organization, the civil societies. And in the government, you have the Federal Ministry of Health and Social Welfare, you have the Ministry of Power, you have the Primary Healthcare Development Agency, you have the Energy Commission, and you also have the Rural Electrification Agency, and organizations like the WHO, the UNDP, and the Clinton Health Access Initiative. And of course, the numerous other organizations, health leaders, private sectors. This is the first time they will be coming together to unpack a compact policy that addresses the health needs of the health sector, so that we can banish those stories of the past where drugs expire because we cannot store them properly, because our vaccines lose their potency because we've been a break in the cold chain, or even hospitals grown under the climbing cost of energy needs. We do know from the data available to us that as much as 10 to 40% of the overhead in some health facilities goes to energy needs in the form of payment to the energy provision agencies, in the form of payment for diesel, for generator, and all of that. But the alternative would be to come up with a strategy that provides some form of climate-friendly, sustainable, cost-efficient energy, which is basically from alternative sources like solar and the rest. So that is what a summit like this that is being planned for tomorrow and next tomorrow aims to achieve.
All right, so we've had a lot of discussions, a lot of summits. What would make this one, the outcome of this one, actually something that we'll actually feel, when it comes to the health sector, that we'll actually see power and not make it just another, dialogue, people come together, but no impact?
Well, the interesting thing about this time is that you have the kind of players that you have in place. Like I pointed out, you have the government, you have private sector, you have development organizations, and you have innovators from the private sector who will be presenting all kinds of solutions, cost-efficient solutions, evidence-based solutions that can drive this process. I would give you a slight example of there are private facilities across the country who have, we are well aware, have adopted solar power with inverters. In fact, one in particular that I'm fully aware about saw a drop in their energy needs and cost to provide energy in the facility dropping by as much as 75%. In one case in particular, the total expenditure on power, on the power from the independent producers of power dropped from as much as 1.6 million to just 300,000 naira a month. So imagine that private facilities, government facilities key into this initiative, and everybody discusses passionately, providing solutions that are sustainable. It will go a long way in reducing the groaning impact of expanding and increasing cost of energy in the health sector. This will also increase efficiency to start with, because a lot of the facilities, if you have a facility that runs only 6 hours out of 24 hours because of limitation to access to energy, and you now have that facility running 24 hours, you can preserve drugs for longer, preserve vaccines for longer, you can offer services for longer periods. You can run your theaters, address emergencies, all throughout the day to a large extent, and that would of course increase the efficiency, because despite the limitations we have in terms of human resource, the absence of energy undermines the efficiency of the current level of human resource we have. So we will be dealing and addressing multi-dimensional challenges that are undermining the efficiency of the health sector by coming together, coming up with a compact agreement, looking at solutions driven by Nigerians and supported by development partners, and of course supervised by civil society organizations.
All right, looking forward to it. The Power in Health dialogue. Hopefully we solve all of these issues. Thank you so much, Dr. Agbo Ebuta, the Vice President, Medical Initiative for Africa, Abuja. All right.
Always a pleasure to be here. So it's coming up tomorrow and next tomorrow, and of course it's holding at the State House Banquet Hall. So we expect everyone to show.
Thank you so much.